Well, thanks. Actually, we're going to check out Jim Speiser here, the good doctor, as it gets closer to the fall. It's cold and flu season, but not just for you and me and him, Jim. It's also something you need to watch for in your pets. And Dr. Speiser is here with what we need to know when we're thinking about protecting our pets when it comes to the flu season, because it's not something that necessarily is top of mind. You're more concerned about the kids and the older folks in our family, but we should be thinking about dogs. And why is that specifically?
I mean, there is a flu that affects our dogs. Okay, it really started about 15 years ago, where there was a strain H3N8 that got introduced or discovered really in the southern United States, and it was it's a respiratory disease in dogs, and then as flu does, it mutates, and about 3 years ago we got a new strain H3N2 that's very, very contagious in dogs, and so much so that practically any dog that comes in contact with it will harbor the virus. Not that they all get sick, but they will harbor the virus and they can then spread it to other dogs, and that's what makes flu such a threat. Now, we don't really consider it like a core disease that we have to vaccinate against, but
okay, that was one of my questions.
Anybody that's going to be traveling with their pets or that has their pets and go to daycare, doggy daycare, or that board their pets. Most of the boarding facilities now are requiring it.
Yeah, you think about it at vacation time, it is strictly dog to dog. What are some of the symptoms that you should be looking out for to think, man, maybe this is not kennel cough? It's not the same thing.
No, but it is a respiratory disease, like you say. It's not like stomach flu like we think of the flu. This is a respiratory disease. It starts out with sneezing, nasal discharge, ocular discharge. They definitely feel horrible. They're very lethargic, and they will run a fever. And it's not necessarily a disease that we consider that's going to cause death, that sort of a disease.
Even in older dogs?
It's extremely contagious. Certainly in older dogs, or very, very young dogs, it can be bad enough to cause then a pneumonia and cause their demise.
Does it run its course? Is there something we need to do in terms of treatment? Do we need to bring the dog to the vet?
Absolutely, you'd want to bring your dog to the veterinarian, and because they can get dehydrated. There are medications that can be utilized. Sometimes these dogs do have to be hospitalized for a day or two with really severe symptoms, but most of the time it's a self-limiting disease, but it's very contagious. That's the thing about flu. It just spreads like wildfire, and we've been fortunate in Indiana not to have a really severe flu outbreak, but Illinois has had one, Missouri,
Really?
Kentucky. We've been lucky so
Well, you
far.
think of heartworm, you think of Lyme disease from ticks and whatnot. It makes me wonder. I wonder if my dog has ever had canine flu. Probably not, because it seems like it's something that Indiana has been spared, when compared to other states.
Yes, relatively so. We've had spotty flu that's been identified for sure in Indiana, but not like they've had in Chicago area, the St. Louis area, and even in Kentucky last year they had a really severe outbreak.
Well, that's why you're keeping us ahead of the curve.
Yes.
How's Rosie doing? We usually bring Rosie
wasn't
along.
feeling good today, so she couldn't come, but I think she raided the cat boxes over the weekend. So.
Well, that does not sound good.
Yeah.
I would have.
That's
Rosie,
her favorite.
Rosie knows better than that.
Yeah, she does, but that things happen.
Oh gosh, what an image there. I need to move on. Dr. Speiser with IndyVet Emergency and Specialty Hospital for a list of all the services and chances to learn about our pets. We've got a link at fox59.com. Tell Rosie we said hi and enjoy your short work week.
Okay,
Dr.
thank you.
Speiser. All right, Jim O'Brien,
Yes,
how's
sir.